we will start the second part or second lecture of target KD Tripathi. Okay, in this we have completed up to prescription and non-prescription drug in the last class. Now we will start from there, prescription and non-prescription drug. Okay, so please give me a second. 1 second. So let's start. Prescription and non-prescription drugs. Prescription drugs are those drugs which should be sold even which should be sold under the in presence of a prescription written by any registered medical practitioner, so any RMP. So a drug which should be sold in presence of RMP only is called prescription drug. Okay, and non-prescription drugs are also called OTC drug, that is over the counter drug. This drug can be sold in absence of any prescription, and even it can be sold by the grocery stores also. Okay, it can be sold by the grocery stores also. So please give me a second. So let's start. As per the drug rules, majority of the drugs, including all antibiotics, must be sold in retail only against a prescription issued to a patient by a registered medical practitioner. All antibiotics, you have to focus on that, all antibiotics. Okay, these are called prescription drugs, and in India they have been placed in Schedule H. In India they have been placed already. I have prepared a video that is on different schedules from Schedule A to Z. In that you will see Schedule G is the drug which should be taken in the medical supervision, and Schedule H are the drug which should be sold in presence of any prescription which should be written by RMP, that is registered medical practitioner. Okay, so this drug have been placed in Schedule H of the Drugs and Cosmetics Rule 1945 as amended from the time to time. However, few drugs like simple analgesics, paracetamol, aspirin, antacid, laxatives, senna, lactulose, all these are senna and lactulose are the example of laxatives, and vitamins, ferrous salts, etc. are considered relatively harmless and can be procured without a prescription. These are called non-prescription drug, or they are also called OTC drug. OTC drug means over-the-counter drugs, and can be sold even in groceries also. Okay. So next are of orphan drug. These are the drugs or biological products for diagnosis or treatment or prevention of a rare disease or condition, for a rare disease or condition or a more common disease endemic only in resource poor countries, for which there is no reasonable expectation that the cost of developing and marketing it will be recovered from sales that of the drug. So the list includes sodium nitrate, fomepizole, liposomal amphotericin B, and miltefosine, rifabutin, saxaimar, somatropin, digoxin, immune fab, digoxin antibody, and liothyronine or levothyroxine, T3, and many more. Though these drugs may be life-saving for some patients, they are commercially difficult to obtain as a medicinal product. Government in developed countries offer tax benefits and other incentives to pharmaceutical companies for developing and marketing orphan drugs. Okay, so Orphan Drugs Act in USA. Example, Orphan Drug Act in USA. Next, one of the most important topic for the general pharmacology is route of administration. So what are the routes of administration? There are so many routes of administration. First of all, what is route of administration? Route of administration means the drug which should be taken, or the drug which should be introduced into a body, in how many ways, in how many routes you can introduce a drug inside the body. All the routes are called routes of administration. That means you will administer the drug inside the body. Okay, so most drug can be administered by a variety of routes. The choice of appropriate route in a given situation depends on both on drug as well as on patient related factor. So you have to focus on one thing, both on drug as well as patient related factor. So administration of drug inside the body is only dependent on the types of drug or types of dosage form. True or false? False. Only depend on patient related factor. True or false? False. It is related on both the drug or dosage form as well as patient related factor. True or false? True. Mostly common sense considerations, feasibility and convenience dictate the route to be used. So route can be broadly divided for those are local action and systemic action. So the broadly divided route are local action and systemic action. So we'll see that later. First see the topic. See, local route. Local route. This route can be only be used for localized lesions at accessible sites and for drug whose systemic absorption from this site is minimal or absent. You are taking a drug which is not absorbed properly from your stomach. If you are taking a drug, the drug after you intake or you are eating a drug, if the drug is not absorbed properly from your stomach or your GIT, gastrointestinal tract, to the systemic circulation, that is veins or circulatory system, then what will happen? Whenever I'll explain it. Whenever you will take a drug, what will happen? If it is going down and it is going into your stomach and it is not absorbing properly, then what will happen? This drug will not go to hepatic metabolism. Even it will not go properly and it will not act properly. Ultimately, the pharmacokinetic as well as pharmacodynamic property will be reduced. Rate of absorption, when there is no rate of absorption, there is no bioavailability. When there, like, if reduced rate of absorption is there, then reduced bioavailability will be there. When reduced bioavailability will be there, the concentration of drug into the systemic circulation will be less. When the concentration of drug into the systemic circulation will be less, what will happen in that case? The activity, pharmacological action of the drug or the therapeutic effect of the drug will also be less. And if you are taking a drug in a route in which it will not show a proper therapeutic effect, then what is the use of taking that drug? If you are taking a drug or a medicine which should having more therapeutic effect, but if you are taking in a way, in a route, so that it will show its effect late or it will show its effect very less, then what is the use of taking that drug? Am I clear? So in that case, you will choose another route by which you will take the drug, or the drug intake will be happening, and at that case what will happen? It will show its effect properly. Okay. So in that case, what is showing? What is telling that at accessible site for drug whose systemic absorption from this site is minimal or absent. That means, for example, you are taking a drug, a tablet, and you are after taking tablet will go to the stomach, and if the absorption from stomach to the systemic circulation is less, then what will happen? The concentration or bioavailability of the drug in the stomach will also be less. When the absorption and bioavailability will be less, the pharmacological action or therapeutic effect of the drug will also be less. In that case, we have to choose the other route to administer the drug into the body. Okay, so in that case we will choose the local route. Am I clear? So thus high concentration are attained at the desired site without exposing the rest of the body. In that case, you will not provide the drug to the whole body, but you will mainly attain the peak level on the desired site by exposing the drug on the desired site. Okay, so exposing the drug. Okay, systemic side effect or toxicity are consequently absent or minimal for drugs in suitable dosage form that are absorbed from the sites or route. The same can serve as a systemic route administration. Example: glyceryl trinitrate applied on the skin as ointment or transdermal patch. The local route are Okay, so glyceryl trinitrate glyceryl trinitrate is directly provided on the body. How? By applying on the skin as an ointment or by using as a transdermal patch. It is not taken orally or in any other route. Rather, it is directly provided on the skin. What is glyceryl trinitrate? GTN, glyceryl trinitrate, is a vasodilator. Okay, am I clear? So by this way, you will take the drug. So ultimately, normally you can the different routes, local routes are: number one is topical. Topical means this refers to the external application of the drug to the surface for localized action. This refers to the external application of the drug to the surface for localized action. Means you are taking a drug. For example, you have some problem in lungs, or you have some problem in eyes, you have some problem inside the eye. Now if you are taking a drug through the mouth, then first of all it will go from mouth to the stomach, then stomach to the circulatory system, then circulatory system to the liver, then liver to the circulatory system, again from circulatory system it will come to the eye. Yes or no? It will take so much time, it will take so much time. But if you are directly if you are directly applying the drug onto the eye, then what will happen? The medicine will directly interact there. Drug will directly act on the desired or specific site. Yes or no? So that is better. Yes or no? So that's why it refers to the external application outside the body of the drug to the surface for localized action. For example, you are applying on the skin of your hand. So directly it will act on the specific local area. It is often more convenient as well as encouraging to the patient. It is easier to use and it doesn't have any side effect, like it doesn't have any it will not harm the patient. Yes or no? So it will be easier. Convenient, that means it will be easier to use. More convenient as well as encouraging to the patient. They can use it easily. Drugs can be efficiently delivered. Directly you can apply the drug or use the drug on the effective area. So to localize lesion on skin. Okay. So oropharyngeal, nasal mucosa, eyes, ear canal, anal canal, and vagina in the form of lotion, ointment, cream, powder, rinse, paints, drops, spray, lozenges, and suppositories or pessaries. So what is pessaries? Pessaries are the type of suppositories which is used inside the vagina. Pessaries are the type of solid dosage form which is used inside the vagina. It delivers the drug directly inside the vagina. That is used locally. Am I clear? That is used locally. Suppositories are used inside the anus. Lozenges are used inside the mouth. Spray you can directly use on the specific, or what it is called, desired area, desired space. Okay. Drops you can use inside the eyes also, inside the ear also. Paint you can use on the skin also. Powder you can use on the specific local area. Cream, ointment, lotion, all these things you can use specifically on the localized area. Am I clear? So what he is telling, the drug can be efficiently delivered to the localized lesion on skin oropharyngeally or nasal mucosa or eye or ear or canal or anal canal or vagina in the form of lotion, ointment, cream, powder, rinse, paints, drops, spray, lozenges, suppositories, and pessaries. Am I clear? Next, non-absorbable drugs given orally for action on GI mucosa, gastrointestinal mucosa. So some drugs are non-absorbable that can directly given orally for the action on the gastrointestinal mucosa, such as sucralfate, vancomycin. Inhalation of drugs for the action on the bronchi. Few minutes ago I only told you. For example, a person is having asthma disease. Then what will happen? If you are if he is suffering from obstruction in the respiration, right? Obstructive respiration, like like these symptoms. In that case, what will happen? You will give the drug towards the oral route, and he will eat the drug. Then it will be absorbed from the stomach to the veins, what it is called circulatory system. Then from circulatory system, it will step by step, it will move, each and every step it will go forward. Ultimately, the patient will die. We need instant action of the drug in that case. So for the instant of the drug, we will directly use the drug topically. And what is the drug? What is the drug? That is beta blocker, or beta agonist, or beta antagonist, like beta receptor agonist or antagonist. Salbutamol, terbutaline, all these things are. Write on the comment fast, write on the comment fast. I'll tell it. Okay. So salbutamol and cromolyn sodium. Salbutamol and cromolyn sodium. And these are directly given through the inhalation by using spray, nasal spray. And irrigating solutions jellies like povidone lidocaine applied on the urethra are other form of topical medications. So these are the drugs which are used locally on the specific or desired area. Okay, next, number 2 is deeper tissue. Certain deep areas can be approached by using a syringe or needle, but the drug should be in such a form that the systemic absorption is slow. Example, intra-articular injection. The injection which are provided in between the bones, that is joint. Intra-articular means in the joint. So hydrocortisone acetate in the knee joint. Okay, infiltration around a nerve or intrathecal injection like lidocaine, and retrobular injection hydrocortisone acetate behind the eyeball. So these are the deeper tissue, and in that deeper tissue you can directly approach by using a injection. Number 3 is arterial supply. So arterial supply means you will directly supply through the artery. So closed intra-arterial injection is used for the contrast media in angiography, and anti-cancer drugs can be infused in femoral or brachial artery to localize the effect for limb malignancies. So what is malignancy? Malignancy is a type of cancer. What are the different types of cancer? Sarcoma, carcinoma, melanoma, leukemia. Yes or no? 4 types of cancer: sarcoma, carcinoma, melanoma, leukemia. These are the 4 types of cancer. So malignancy means actually what will happen when the tumor will grow. First it will be like benign tumor. Then after that it will lose some properties and it will gain some properties. So what are the properties it will lose? That is contact inhibition. Contact inhibition means when a cell will grow, if the cell gets in touch with the surrounding cell, then it will stop growing. When it will come in contact with the surrounding cells, it will stop growing. That is called contact inhibition. And when the cell will lose that property, then what will happen? It will keep growing continuously, invading the surrounding cell. Am I clear? And number 2, what it will gain, what property? So if the cell will grow, then it will grow locally on the specific area. But when the cell will keep growing continuously without following the rules and regulation for the cell growth, and without following the inhibition rules, and if it gains the metastasis property. So what is the metastasis property? Metastasis property means the growing cell will keep moving in the body from one location to the another location through blood, in the circulatory system, through blood. That growing tissue or growing cell will keep dislocating from one location to the other location. That property is called metastasis property. That metastasis property is very, very dangerous. In that case, when a tumor is having metastasis property, that is called malignancy or malignant tumor, and that malignant tumor is a type of cancer. That is cancer only, not a type of cancer. So when the tissue growth will or cell growth will keep stay in one local space or in a specific area, and it will be having property of contact inhibition, in that case it is benign tumor. When the contact inhibition will be lost property, In that case, it will transfer into benign to malignant tumor. And again, when it will gain another property, that is called metastasis property, that is dislocation or transferring of location from one location to the another, from one area to the other area inside the body through the circulatory system, that is called metastasis property. So gaining of metastasis property in a growing cell or growing tumor turns in it from benign tumor to malignant tumor. And when malignant tumor is there in the body, that malignancy is ultimately cancer. That malignancy is ultimately cancer. So to treat the limb malignancies, we will use arterial supply. Am I clear? Next, systemic route. So what are the three local routes? Three local routes are topical, deeper tissue, and arterial supply. Topical, deeper tissue, arterial supply. Number three is systemic route. In systemic route, the drug administered through the systemic route is intended to be absorbed into the bloodstream. Very, very important point. The drug administered through the systemic route is intended to be absorbed into the bloodstream and distributed all over the body, including the site of action through circulation. In that case, what will happen? The way I mentioned earlier, whenever, see here only, I mean, see, whenever you take a drug, what will happen? After taking the drug, it will go to the stomach through the oral route. After going to stomach, it will be absorbed in the circulatory system, that is veins or arteries, circulatory system. After absorption into the circulatory system, it will go to liver for hepatic metabolism. After going into the liver, it will be distributed all over the body uniformly. It will be distributed all over the body uniformly. So in that case, where the drug is needed, the desired area or the site of action, the drug will automatically reach to the site of action through the circulatory system. And after showing its pharmacological effect or therapeutic effect, the drug will be again excreted out from the body through urine or stool or sweat or exhale through respiration. Yes or no? So this is the way to administer the drug inside the body through systemic route. So what are the systemic route? In that case, you will see through oral route, through parenteral, and other injection and intramuscular, intravenous, and all these all comes under parenteral. Now I will tell you. So in that case, ultimately the drug is supplied to the specific or desired area or supplied to the site of action through the circulatory system or bloodstream. Okay, now we will see. Number one is oral. Now I mentioned just half a minute ago. Oral means you will take oral injection is the oldest and commonest mode of drug administration. It is safer also, more convenient, and does not need any assistance. You will directly take the drug through the mouth, take the drug and drink water, and it will directly go to the stomach. From stomach it will be absorbed easily. So this is the safer, more convenient means easy to use, and does not need any assistance means you don't need someone helps. Okay, and non-invasive means it will not cause any harm. Like if you are taking injection through the oral through the parenteral route, then it will what will happen? It will destroy your tissue. Yes or no? So this is the invasive way. You will get hurt. But oral route is a non-invasive way. You can take the drug very easily, often painless, and medicament need not to be sterile and is cheaper. So both solid dosage form, powders, tablets, capsule, spensules, dredges, and molded tablets, gastrointestinal therapeutic system (GITs), and liquid dosage form such as elixir. Elixir means simple syrup, then emulsion such as liquid form, emulsion in the sense suspension, syrup, and emulsion and mixtures. In mixtures you will see the suspension. Emulsion means liquid form in which one will be the soluble part and another will be soluble medium. So quantity of one liquid will be small and quantity of another liquid will be more. Emulsion already you know it very well if you are studying in the pharmaceutical field. Okay, and mixtures. These all are the dosage form you can take through the oral route. What are they? Solid, liquid. And solid means C. Solid dosage forms such as powder, tablet, capsules, pencils, drugs, molded tablets, and gastrointestinal therapeutic system. And liquid dosage forms such as elixir, syrups, emulsion, and mixtures can be given orally. Am I clear? Now see, what are the limitation of oral route of administration? Limitation means what are the side effect, or limitation in the sense these will cause some distractions. Okay, number one, action of drug is slower. So whenever you will take medicine, it will act very slowly. What I said earlier, I mentioned, explained properly, that if a person is having asthma, and if chronic asthma or acute asthma, like he is suffering from the symptoms such as obstruction in the respiration, obstruction in inhaler exhale, in that case we need an urgent or fast acting drug. We can take a medicine through the oral route, and that medicine will go to stomach, that from stomach it will take 40 to 60 minutes to absorb into the circulatory system, then from circulatory system again it will take 20 to 30 minutes to complete its metabolism, that is hepatic metabolism, then through the circulatory system it will go to the lungs and it will go to the tracheal tissue. It will take so much time, at least 2.5 hours or 3 hours. But we need urgent, fast working. At that time, we will do the local. So, what is the local route? In that case, we will use the spray. And what will be the medicine inside that? What will be the drug? That will be the salbutamol. Yes or no? So, action of drug which is taken through the oral route is having slower activity and thus not suitable for emergencies. Number two is unpalatable drugs such as chloramphenicol are difficult to administer. Drug may be filled in capsule to circumvent this. Means if some drugs are like very thicky and unpalatable, means it doesn't have any proper shape and anything, we can take it properly. To take it easily and invisibly and what it is called conveniently, to take it conveniently, what we have to do, we have to make a dosage form in which we have to cover that up with other things. Okay, so that is called, in that case we will make it in the form of capsule. And the drugs which are taken or administered through oral route may cause nausea and vomiting. May cause nausea and vomiting. This is very, very common. Nausea, vomiting. Next, the drug which are administered through oral route cannot be used for uncooperative or unconscious or vomiting patient. If a patient is having, if a patient is senseless, or he is not cooperating, he is unable to cooperate properly, or he is vomiting again and again, whenever he is taking something he is vomiting, in that case it is not possible to administer or supply the drug into the body through the oral route. Okay, absorption of drug may be variable and erratic. Certain drugs are not absorbed, such as streptomycin is not absorbed into the body from GIT, gastrointestinal tract or stomach. That's why what is happens, streptomycin is normally provided in the body through the injection only. Okay, injection means parenteral route. Others are destroyed by digestive juice. So some of the drug will destroy by digestive, some of the drug will be destroyed by digestive juices, and ultimately digestive juice will interact to the drug, and ultimately it will it will cause some disturbances in the action or efficacy. So in that case, C, destroyed by digestive juice such as penicillin G. That's why penicillin G is not given orally. And insulin is given through injection. Penicillin G is also given through injection, but penicillin V can be taken orally. Okay, in liver, glyceryl trinitrate, GTN, glyceryl trinitrate, testosterone, and lidocaine. Glyceryl trinitrate, testosterone, and lidocaine are also got destroyed or digested in the liver. That is hepatic digestion will also take place. That is not digestion actually. Hepatic biochemical reaction will takes place in the liver. Okay. Next, number two. So first one is oral route. Second route is sublingual route. Second route is sublingual route. In sublingual route, what will happen? 1 second, please. Sublingual or buccal. In this, the tablet or pellet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. You will take the medicine, you will take the drug tablet, or it will be in the form of lozenge or capsule, not capsule, lozenge or tablet. You will take in the mouth and you will chew, you will crush inside the mouth, or you will take below the tongue. And what will happen? Only lipid soluble and non-irritating drugs can be so administered. So it will directly be absorbed from the mouth only through sublingual route. Okay. So this is called sublingual or buccal route. Next, absorption is relatively rapid, means fast absorption. There is no problem with absorption, but action can be produced in minutes. Very fast action will show. Though it is somewhat inconvenient, one can spit the drug after the desired effect has been obtained. And some people, what they will do after taking the drug to the sublingual route, they will keep it in below tongue and keep it inside the mouth. Then what will happen? After some time, after getting the effect, therapeutic effect, they will just throw it away or spit it away. And what will happen? It will not be completely absorbed in the body. Like bioavailability will be less, yes or no? So one can spit the drug after the desired effect has been obtained. After getting the desired effect, it can easily throw it away. So the chief advantage is that liver is bypassed and drug with high first pass metabolism can be absorbed directly into the systemic circulation. Directly into the systemic circulation. Drugs given sublingually are glycerol trinitrate, that is vasodilator. Drugs given sublingually are glycerol trinitrate. Next, buprenorphine, buprenorphine and desamino-oxytocin. Most commonly used this one, glycerol trinitrate. It is given through sublingual route only for fast and effective therapeutic effect. Next, number 3 route is rectal route. So what are the systemic route? Number 1 oral route, number 2 sublingual route, number 3 rectal route. So certain irritant and unpleasant drugs can be put into the rectum as suppositories and retention enema for systemic effect. This route can also be used when the patient is having recurrent vomiting or is unconscious. However, it is rather inconvenient and embarrassing. Absorption is slower, regular, and often unpredictable. Though diazepam solution and paracetamol suppository are rapidly and dependably absorbed from the rectum in children. Okay, are you getting the point? So in some cases, for example, if a patient is senseless or if a patient is vomiting, then you can put the suppository inside the rectum and keep there. Then what will happen? From the rectum, the drug will be absorbed in the systemic circulation, passed into the systemic circulation, and then after absorption of drug into systemic circulation, it will start showing its steps like metabolism, and then it will start showing its therapeutic effect. But one thing is that it is rather less, it is embarrassing. Obviously, it will be embarrassing and inconvenient. But the most important point is there is that it has slower rate of absorption than that of buccal or sublingual route. Okay, and it is even irregular and often unpredictable. Though diazepam solution and paracetamol suppository rapidly dependable absorbed from the rectum. So diazepam and paracetamol are rapidly absorbed from the rectum into the systemic circulation. Drug absorbed into the external hemorrhoidal veins about 50%. Bypass liver, but not that absorbed into internal hemorrhoidal veins. That means what is hemorrhoidal? In in the area where rectum is present, in the rectal area, you will see two hemorrhage. One is internal hemorrhage, one is external hemorrhage. In the internal hemorrhage, some veins will be there, and in the external hemorrhage, also some veins will be there. So 50% of the uh, 50% of the drug will be absorbed in the external hemorrhageal vein, but very less or no internal hemorrhageal veins That means there is no drug absorbed in the internal hemorrhageal veins. So for example, this is the rectum, this is your rectum, that is the internal sphincter, internal rectal sphincter, and that is the external rectal sphincter. Here you will see one hemorrhage, some veins will be there, and here also some veins will be there. So these are the internal hemorrhageal vein and these are the external hemorrhageal vein. So most of the drug will be absorbed into the 50% of the drug will be absorbed into the external hemorrhageal vein when you will put the suppository here like this. This is the suppository you will put inside the rectum. Okay, so what will happen when you will put the suppository inside the rectum? 50% of the medication or the drug will be absorbed in the external hemorrhagic veins, but very minimum or even no absorption will be there in the internal hemorrhagic veins. Okay, rectal inflammation can result from the irritant drugs. Example of drugs such as diazepam, indomethacin, paracetamol, ergotamine, and few other drugs are some of the sometimes even provided or administered through the rectal route. Okay. Next, cutaneous route. Next is cutaneous route. So cutaneous route means highly lipid soluble drugs. Why highly lipid soluble drugs? Because our skin has the cell walls and the cell wall are made up of lipid bilayers. Yes or no? Cell wall are made up of lipid bilayers. So to absorb any drug through the cell wall, it will be better to be lipid soluble. Why it will be better to be lipid soluble? A universal line is there, maybe you people will know it very well. A universal line that like dissolves like dissolves like means a polar substance will be dissolved better in polar substance and a non-polar substance will be dissolved better in non-polar substance. Simply you can say uh, a polar substance or an ionic substance will be dissolved in a polar medium or an ionic medium, whereas a nonpolar substance or non-ionic substance will be dissolved better in nonpolar medium or non-ionic medium. That is called like dissolves like, and it is universal. So polar substances are soluble in water and non-polar substances are soluble in non-polar liquid like benzene, acetone, etc. Why? Because water is polar. Water is polar. See, hydrogen, oxygen, hydrogen. So what will happen? This oxygen is more electronegative. So it will try to attract the electron towards itself. So this will be del negative. So when del negative, what is the meaning of del negative? It is partially, it is having partial electron density more, and that hydrogen will have less electron density partially, so it will be del positive, partial electron deficient, and it will be partially electron rich. So ultimately what will happen, the polarity will be in this way. Wait, I'll show you in different colors. So the polarity will be in this way, and other from other hydrogen the polarity will be in this way. So ultimately what will happen, the resultant polarity will be in this way. So that's why water is polar and it is ionic. So an another polar or ionic substance will be absorbed better in water, and benzene or acetone, they are non-polar. So that's why any other non-polar or non-ionic substance will be absorbed in benzene or acetone in better or proper way, in good condition. Am I clear? So that's why our skin is made up of lipid bilayers. Lipid bilayers means, see, this is our cell. This is, okay, wait. This is our cell and this is the cell membrane. This cell membrane is made up of lipid bilayers means it will be like this. See, in that you will see one lipid layer and you will see another lipid layer. That is called lipid bilayer. So this blue color is lipid and that one is also lipid. Along with that, some ingested protein will be there, which will be inside the layer, throughout the layer. outside and inside. Okay, so to absorb something through the lipid bilayer, that something, that substance should also be lipid soluble. That's why highly lipid soluble drugs can be applied over the skin for a slow and prolonged absorption. The liver has also bypassed. The liver is also bypassed. The drug can be incorporated in an ointment applied over specified area of skin. Absorption of drug can be enhanced by rubbing the preparation. Absorption of drug can be enhanced by rubbing the preparation by using an oily base or by an occlusive dressing. Okay, so whenever you will put some drug on your skin, you have to rub it properly, then it will ultimately enhance the absorption of the drug. Put some medicine, drug, ointment or cream or even lotion, you will rub it properly. When you will rub it properly, the absorption of the drug will be more, it will be increased. That is called enhance the absorption. Next, transdermal therapeutic system. Next we will see transdermal therapeutic system. So what is transdermal therapeutic system? These are the devices in the form of adhesive patches. Nowadays it is used very highly used technique to deliver the drug inside the body is transdermal patches. So transdermal therapeutic system, TTS, these are the devices in the form of adhesive patches. Adhesive means it will just tap, or it will just what it is called, it will fit on the skin, like there will be some gummy. So adhesive patches means it will fit on the skin like this, like plaster, of various shapes and sizes. The sizes will be 55 to 20 centimeter square area. The size will be 5 to 20 centimeter square area, which deliver the contained drug at a constant rate in the systemic circulation. That's why these are called sustained release drug. Sustained release drug means it will be having predetermined rate of delivering the drug inside the body. When the drug will be delivered from that patch, it will go inside the body slowly, step by step, time by time, slowly in a predetermined rate. Now these are so specific that you can use a patch of having 3 hours, 5 hours, 6 hours, 7 hours like this. You are not taking paracetamol because its taste is not good. For like a children having 7-8 years, he is not taking a paracetamol because of a very kadwahat taste, like taste, very bad taste. So what you can do, you can use the transdermal patch. By using adhesive patch or transdermal patch, you can deliver this paracetamol inside the body slowly, step by step. It is also used right nowadays. It is highly used in the treatment of PCOS, PCOD, polycystic ovarian syndrome, polycystic ovarian disease, hormonal imbalance, and other. Even it is used to deliver the nutrition inside the vitamins, minerals, and all these things inside the bodies. And it is also used now in the treatment of obstructive compulsive disorder. No, what it is called, IBD, inflammatory bowel disease and inflammatory bowel syndrome. Okay, mainly used in the hormonal imbalance, PCOS, and in some cases nowadays it is used mostly in all over the platforms for the treatment of different diseases. So ultimately, what is the transdermal therapeutic system? In this, there will be a device used on the skin which is already having a predetermined rate to deliver the drug inside the body. Okay, so the drug in solution or bound to polymer is held in a reservoir between an occlusive backing film and a rate controlling micropore membrane. So see, controlling micropore membrane, rate controlling in the sense predetermined rate. Rate controlling means predetermined rate. And what is the membrane name? Micropore membrane. These are the very important points for nowadays competitive exam. So occlusive backing and film and a rate controlling micropore membrane, the under surface of which is smeared with an adhesive impregnated with priming dose of the drug. The adhesive layer is protected by another film that is to be peeled off just before the application. Before using that transdermal patch, you can remove one, peel off one membrane. After that, you can directly fit on the skin, on the shoulder, on the head, on the back, on the chest, or anywhere, even on the stomach. Mainly, it is used on the what it is called, phalanges, not phalanges, appendicular, hands and legs. Legs means on the thigh, or hands on the bicep, on the tricep. It is mainly used. Okay, you can directly fit that patch and it will continuously deliver slowly, little by little. The drug is delivered at the skin surface by diffusion or percutaneous absorption into the circulation. The microphone membrane is such that the rate of drug delivery to skin is less than the slowest rate of absorption from the skin. So why slowest rate of absorption? To deliver the drug for longer duration, sustainable drug release. Okay, so these offset any variation in the rate of absorption according to the properties of different sites. As such, the drug is delivered at a constant and predictable rate irrespective of the site of application. So predictable rate, ultimately rate of drug delivery is very important in the case of transdermal patches, irrespective of its site of application. Usually chest, I already mentioned, abdomen, I have mentioned, upper arm, I have mentioned, lower back, I have mentioned, buttock, I didn't mention, and mastoid region are utilized. Transdermal patches of glyceryl trinitrate and fentanyl and nicotine and estradiol are available in India, while those of isosorbide dinitrate and hyoscine, and clonidine are marketed elsewhere. For different drugs, TTS, transdermal therapeutic system, have been designed to last for 1 to 3 days. Though more expensive, they provide smooth plasma concentration of the drug without the fluctuations, minimize inter-individual variations, and drug is subjected to little first pass metabolism and side effect. So there is very little or no minimum side effects. Okay, they are also more convenient. Many patients prefer transdermal patches to oral tablets of the same drug. Patient compliance is better. Patient compliance means they can use, the acceptance of patient is better. Local irritation and erythema occurs in some, but it is generally mild, can be minimized by changing the site of application each time by rotation. So discontinuation has been necessary in 2 to 7% cases due to some irritation, some allergic reaction, or some other conditions or adverse effect. In the 2 to 7% of the users, it is discontinued. Okay, now we will see the illustration of transdermal drug delivery. See, this is the transdermal patch. This is the gummy or adhesive part. This part. Wait, I'll show you. This part is the adhesive part. Adhesive part. And if you see the yellow color part, between the yellow colored parts you will see small micropores through which the drug will be delivered in a controlling rate. Okay, and if you see a small pool, in that the drug will be filled, and to cover that, for the safety, to cover or save that, there will be a backing film that is little bit hard. Okay, So what will happen when the drug will be delivered into the body? Slowly through the subcutaneous route, the drug will be delivered inside the body, and the subcutaneous vein, intradermal subcutaneous veins will absorb from the skin, under the skin, and it will take the drug into the circulatory system. Okay, and before that we will see another thing. See, this is the different route. So this is intranasal spray, which is used through the nose, and transdermal patches, that is now only adhesive patches fit on the skin, and intramuscular injections that will be injected directly inside the muscle. Next, intravenous injection, that is through parenteral route. Okay, transdermal patch, that is topical route. Intranasal topical route. Sublingual tablet, that is uh, systemic route. Fast pass metabolism in lungs, that will happen in the lung. Okay, oral route, some you will take through oral route, that will also come under the systemic drug delivery system or systemic route of administration. Next, fast pass metabolism will happen inside the liver. After fast pass, see, you have, whenever you have taken a drug, so after taking the drug, what will happen? First of all, the drug will go to the stomach. Then from stomach, what will happen? It will go through the portal vein. Through the portal vein, it will go to liver, and in liver, it will undergo fast pass metabolism. After fast pass metabolism, this is the oral tablet. After fast pass metabolism, it will be completely circulated in the circulatory system, and through circulatory system it will be delivered to the whole body and to the site of action. Okay, after fast pass metabolism in intestinal wall, now what will happen? After the therapeutic activity, now this drug needs to be excrete from the body. So 50% is subjected to fast pass metabolism, and okay, this is suppository, this is the rectal route. Okay, so after fast pass metabolism, some will come out through the from the body through either urine, or through sweat, or through stool, or through the exhale of respiration, that is gaseous route. Okay, now we will see a small table we left earlier, this one. Factors governing the choice of route. So what are the factors that will govern you to choice in which route you should administer a drug into the patient body? So the factor is number one, physical and chemical properties of the drug. Number one, physical and chemical properties of the drug. That is solid or liquid or gas form, that is the dosage form. Solubility, stability, pH, irritancy. Now if a drug is having less solubility, you will not take through the oral route. If a drug is having less stability in pH or acidic environment, you will not take through the oral route. If a drug is unstable in pH, if a drug is irritant or causing the immediacy, that is vomiting or anything, you will not take through the oral route, you will take in other route. So like this, you will decide. If it is in gaseous form, you will take through the nasal spray, yes or no? If it is in liquid form, you will drink through the oral route. If it is in solid form, you will take through the oral route, like this. So physical and chemical properties of the drug. Number two, site of desired action. Site of desired action, localized and approachable, or generalized and not approachable. That means, for example, what I mentioned earlier, if you are having a problem in the stomach, you will take directly through the oral route. If you are having an infection in the or if you are having any problem, that means site of action, if the site of action is trachea, bronchi, bronchiole, primary bronchiole, lungs, and alveoli, then you will take through the nasal passage, it will be easier. You will choose the nasal spray. And if it is in the eyes, you will use nasal topical drop. If it is on the others area, then you will take through the systemic circulation, or you can take through the oral route. So like this, the site of desired action also governs to choose the route of administration. It has also importance in the choosing of route of administration of the drug. Number 3, rate and extent of absorption of the drug. If the drug is absorbed faster, the rate of absorption of the drug from the gastrointestinal tract is more, then you will take through the gastrointestinal orally very, but it has very less absorption, then you will take in other, you will choose the other route of administration. Okay, so in different drug from the different routes. Number 3, effect of digestive juice and fast pass metabolism of the drug. If you are taking a drug, and if such as penicillin G, and if it is affected by the gastric juices or any other juice, then what will you do? You will take through the oral route? No, you will not take through the oral route. Wait, I'll show you some example. See here only. This one, streptomycin. See, streptomycin. You will not take through oral route. Penicillin G, you will not take the oral route. These are administered in the body through injection. That means parenteral route. Okay, so that thing is there. Next, rapidity with which the response is desired. If you need fast response, you will use topically or locally. If you need slow and longer, for longer duration, sustainable activity, if you need, then you will use it through oral route or some other route or systemic route. But if you need rapid onset of action, that is fast action, then you will use topically, locally. Next, accuracy of dosage required. If you required high dose concentration, you will use directly in the local route of administration. Otherwise, you can use through the oral route of administration. But you have to remember, in oral route of administration, the absorption of drug is taking place, and after the absorption of drug, the concentration of drug that you have delivered into the body and whatever the drug is present in the systemic circulation will be different, varying. For example, you will take a 500 mg paracetamol tablet, but 20 to 30% of the drug will be absorbed into the body after after the peak attaining absorption, after complete absorption of the drug from the gastrointestinal tract to the circulatory system, you will see only 20 to 30% of the drug is present. The bioavailability is 20 to 30%, so you have to remember that. Okay, next, condition of the patient. If the patient is unconscious or vomiting, you can take through orally. You have to administer the drug in other route of administration, in other route. Yes or no? So you have to remember all these things. What is note? The total drug absorbed orally is subjected to first pass metabolism in intestinal wall and liver, while approximately half of the absorbed from the rectum passes through the liver. What is said? So the absorption orally, whatever the drug is absorbed from orally, it will subjected to fast pass metabolism into the intestinal wall and liver, while 50% of the drug, half of the drug absorbed from the rectum or rectal route passes through the liver. Drug entering from any systemic route is exposed to fast pass metabolism in lungs, but its extent is minor for most of the drug. So in any route you will take any drug, it will go through lungs for fast pass metabolism, but in very less extent. Extent is minor, and in more extent it will go through the fast pass metabolism in liver, and if you are taking orally, then in intestinal wall also. Okay, so fast pass metabolism is more in high extent in liver, and in lower extent in intestinal wall and lungs. Okay na? So I think we have completed up to this. So what are the route of administration? Local already we have completed. Then systemic. In systemic, what we got? Number one is oral, number two is sublingual, number three is rectal, number four is after rectal. What was there? Oral, sublingual, rectal, cutaneous, cutaneous and subcutaneous. Next, number five is inhalation, number six is nasal, and number seven is parenteral. Okay, so inhalation means volatile liquids. Volatile liquids and gases are given by inhalation for systemic action. General anesthetics. Absorption takes example general anesthetics. So general anesthetics are given through the inhalation. Absorption takes place from the vast surface of the alveoli. Action is very rapid. Very rapid means fast. Rapid onset of action means very fast action you will see. Action is very rapid, and when administration is discontinued, the drug diffuses back and is rapidly eliminated in the expired air. Thus, controlled administration is possible with moment to moment adjustment. Irritant vapors, irritant vapors such as ether cause inflammation of respiratory tract and increases the secretion. Increases the secretion. Okay. Next, nasal passage or nasal route. So, what are nasal route? The mucous membrane of the nose can readily absorb many drug or digestive juices, and liver are bypassed. However, only certain drugs like GnRH, gonadotropin releasing hormone agonist, GnRH agonist, and desmopressin applied as a spray or nebulized solution have been used by this route. This route is being tried for some other peptide drugs like insulin as well as to bypass the blood-brain barrier. Next, seventh route, that is parenteral route. So what is tried in this route in the nasal passage? Number one is gonadotropin releasing hormone agonist, GnRH agonist, and desmopressin. GnRH agonist and number one is GnRH agonist and desmopressin. GnRH agonist and desmopressin applied as a spray or nebulizer solution have been used by this route, and this route also tried for peptide drug. So peptide drugs such as insulin. Insulin is a example of peptide drug as well as to bypass the drug. Okay. Next, parenteral route. Parenteral route means through the injection, through the veins and all these things. So par means beyond, enteral means intestinal. So if you are administering a drug into the body without the interfering of gastrointestinal tract or intestine, then it is called parenteral drug. So par means beyond and enteral means intestine. So conventionally, parenteral refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the enteral mucosa. Why enteral mucosa? Crossing of enteral mucosa has any effect? Yes, crossing of enteral mucosa will make the onset of action slower or late. So late onset of action will be seen in the case of absorption of the drug from the GIT to the circulatory system. So to make it fast, rapid, to get the rapid onset of action, what will happen? A drug will be administered into the body directly through the tissue fluid or blood without having to cross the enteral mucosa. The limitation of oral administrations are circumvented. Drug action is faster and surer, that is valuable in emergencies. Drug action is faster, that is called rapid onset of action. And gastric irritation and vomiting are not provoked. Parenteral routes can be employed even in unconscious and uncooperative or vomiting patient. If a patient is senseless or unconscious, or he is not cooperating with the physician or doctor or the person who is doing the therapy, still we can administer the drug inside the patient body through the parenteral route. If the patient is vomiting, still we can use parenteral route. So these are the advantages. So unconscious, uncooperative, and vomiting patient can also be having or administered the drug inside their body through using parenteral route. There are no chances of interference by food or digestive juices. These are all the advantages, and liver is bypassed directly. Next, disadvantages of a parenteral route are the preparation has to be sterilized, because if you are taking a drug orally, then when the drug will enter inside the gastrointestinal tract or stomach, definitely there are digestive juices, gastrointestinal juices are present, and it will kill all the bacteria or pathogen or any kind of impurities if present. Then it will be filtered out inside the stomach. That's why the solution or the dosage form need not to be sterilized if you are taking through oral route. But if you are taking or administering a drug through the parenteral route, then there is no digestive juice, there is no stomach, no filtration. It is directly entering inside the circulatory system, and that's why the preparation or the dosage form must be sterilized. Okay, so disadvantage of parenteral route are the preparation has to be sterilized and it is costlier. The technique is invasive. Invasive means it will damage the tissue whenever you are using the whenever you are having application of this route. So it will damage tissue. That is, technique is invasive and painful. Ultimately, pouring an injection or entering an injection inside the tissue is painful, and assistance is also required. Assistance of another person is mostly needed, though self injection is possible. Example, insulin in the case of diabetes. So in the case of diabetes, insulin are directly administered into the body by the person or by the patient. But in other cases, the assistance of some other person is required for having an application of drug administration into the body through the parenteral route. Okay, there are chances of local tissue injury, that is invasiveness, and painful. In general, parenteral route is more risky than oral route. The important parenteral routes are: number 1, subcutaneous route; number 2, intramuscular route; and number 3, intravenous route; and number 4, intradermal injection. Okay, so these all are the different route of the different parenteral route. So in the case of subcutaneous route, the drug is deposited in the loose subcutaneous tissue. The drug is deposited in the loose subcutaneous tissue, which is richly supplied by nerves. Irritant drug cannot be injected, but is less vascular. Absorption is slower than intramuscular. So in the case of subcutaneous, the absorption of the drug is little bit slow compared to that of intramuscular. Only small volumes can be injected. Subcutaneous self-injection is possible because deep penetration is not needed. So self-injection is also possible because there is no deep penetration is not needed. So self-injection is possible because deep penetration is not needed. This route should be avoided in shock patient who are vasoconstricted and absorption will be delayed. That means if you need any rapid onset of action, you can't use you are not supposed to use, or you are not advised to use the subcutaneous route of administration if you need any rapid onset of action. Okay, so these routes should be avoided in the shock patient who are vasoconstricted or absorption will be delayed. Respiratory or depot penetration that are aqueous suspension can be injected for prolonged action. Some special form of this route are: number one, dermojet. So what is dermojet? Dermojet is a type of is an equipment or medical device which is used to administer the drug inside the patient's body through parenteral route and in specifically through the subcutaneous route. In this method, needle is not used. A high velocity jet of drug solution, okay, I'll mention later. So, a high velocity jet of drug solution is projected from a microfine orifice using a gun-like implant. The solution passes through the superficial layer and gets deposited in the subcutaneous tissue. It is essentially painless and suited for mass inoculation. Okay, so in dermojet, there is no needle used. So there is, see. In dermojet, in this method, needle is not used, but a high velocity jet of drug solution is projected from the microfilm. That means the drug solution will be directly thrown or projected from the, what it is called, implement, gun-like implement, from a microfine orifice, means very small teeny micropore, and the solution passed through the superficial layer, that means skin layer, and gets deposited inside the subcutaneous layer or subcutaneous tissue. From the subcutaneous tissue, it will be absorbed slowly inside the circulatory system. That is dermojet. So injection, or what it is called, needle is used in dermojet? No needle is used. Next, number 2 is pellet implantation. So in the case of pellet implantation, the drug in the form of a solid pellet is introduced with a trocar and cannula. This provides sustained release of the drug over weeks and months. Example are DOCA and testosterone. Okay. So what I'll like to tell you is that in that case, this is used for hormone imbalance. This is used for hormone imbalance. Okay. If you will see, this pellet implantation is used to administer the drug inside the body through the subcutaneous route, which comes under parenteral route, again without using the needle, but it is a solid pellet introduced into the body using cannula, and it provides a sustained release. It provides a sustained release of drug for even week or even months. It is mainly used to treat the hormonal imbalance. Example of the drugs are deoxycortisone, deoxycortisterone acetate, deoxycortisterone acetate, that is DOCA, and testosterone. To supply these drugs inside the body, it will be used. That is pellet implantation. Number 3 is sialistic or non-biodegradable and biodegradable implant. So crystalline drug is packed in a tubes or capsule made of suitable materials and implanted under the skin. It will directly implanted inside the skin, and slow and uniform leaching of the drug occurs over months on providing the constant blood level. The non-biodegradable implants has to be removed later on, but not the biodegradable one. So biodegradable will automatically degrade inside the body. Non-biodegradable will not degrade. It will ultimately cause some irritation or some side effect or adverse effect. That's why we need to remove the non-biodegradable substances. That method is called sialistic or non-biodegradable and biodegradable implants. So that is implants. That is called implants. Okay. This is also a way of injecting or administering the drug into the body through subcutaneous route. Okay. Next, intramuscular. It is very easier process. Everyone knows that what is intramuscular. So the drug is injected in one of the large skeletal muscle, deltoid tricep or gluteus maximus or rectus femoris. So the drug is injected one of the large skeletal muscles such as deltoid triceps here, gluteus maximus here, and rectus femoris on the downside on the pelvic region, etc. Muscle is less richly supplied with the sensory nerves and mild irritant can be injected and is more vascular so the drug will directly be absorbed from the muscle to the vascular system or to the circulatory system. So so the most important point is that this is mild irritant and can be injected and is more vascular. Absorption of drug in aqueous solution is faster and it is less painful, but self-injection is often impracticable because deep penetration is needed. And depot preparations, so oily solutions, aqueous suspensions, okay, can be injected by this route. Intramuscular injection should be avoided in anticoagulant treated patient because it can produce the local hemomata. Okay, so I have some urgent work, so we'll complete here and later we will start our next class from intravenous injection. Okay, thank you for being connected with me. Thank you. And if you do like the video, then subscribe and share the video to your friends. And thank you so much. Keep learning.